Today we're going to talk about jaundice. Jaundice is a very interesting medical condition. It's most known for causing a yellowing of the eyes and the skin. So today we're going to learn about why that is. We're going to learn about more of the symptoms of jaundice and how this medical condition works. So let's get into it. So what is jaundice? Well, jaundice is a symptom of some deeper issues. It's easy to recognize because those with jaundice will have a yellowing of their skin and their eyes. This is caused by the buildup of a red-orange compound called bilirubin. So let's talk a little bit more about bilirubin because in order to understand some of the symptoms of jaundice, we have to understand bilirubin. So as we know, our body makes these things called red blood cells that carry oxygen to our organs. Eventually, these cells die and need to be broken down. When they are broken down to a few different things. So we have hemoglobin. This is the molecule that carries heme. Now, heme is what the oxygen attaches to, which gets delivered to the rest of our body. And hemoglobin is a protein present in red blood cells. So when heme is broken down, it produces this thing called bilirubin. It also produces this thing called sterobilin. This is responsible for the brown color in feces. And urobilin, which is partially responsible for the yellow color in urine. These are all waste products. Now, when the bilirubin byproduct is created, it gets stored in the gallbladder, which is this little section right here, specifically in this substance called bile, which is right in here. And then eventually it passes through these little tubes and gets processed and excreted in our body. This is bilirubin right here. And I want to show you guys something real quick. So this is a little baby. This little baby has jaundice. You can tell because there's some yellow in their eyes. And if you look at the skin, it has this yellow tint to it. These are classic jaundice symptoms. If you pause, you can kind of see what I'm talking about. 80% of babies have jaundice. Most of the time it resolves on its own. We'll talk about the cause of that in a little bit, but I just wanted to give you an example of what this looks like in infants. What causes jaundice? Well, there's three different categories of jaundice. First, I want to go up here. So we're going to talk about this word hepatic. It's important to note that the prefix hepat means liver. So hepatic means of the liver. So number one here, prehepatic. Well, prehepatic means before liver. In this case, before liver metabolism. Metabolism being that bodily process our liver does to process the things we consume, whether it's drugs or all sorts of things. It's the filter in our body. In this case, there is an excess of bilirubin made. Well, why is that? What happens is the normal breakdown of red blood cells is elevated. I mentioned earlier that when red blood cells are broken down, bilirubin is produced. So if you have more red blood cells that are broken down, more bilirubin will be produced. So for this case, it's an abnormal destruction of red blood cells. This is one of the reasons why babies can have jaundice. There's a few more. Sometimes as the liver develops, it has a hard time getting rid of the bilirubin. Other times, as excess red blood cells are broken down because a lot more red blood cells are made because the baby has to develop and survive, an excess of bilirubin is produced. At 3 to 7 days after birth, bilirubin spikes. And so after the baby's born, they're monitored to make sure that if there is jaundice, it doesn't continue past a certain point. This excess breakdown of blood cells, red blood cells, is called hemolytic anemia. Then we have intrahepatic jaundice. This occurs within the liver. So this is an abnormal processing of bilirubin, which increases its presence in the body. This is oftentimes caused by viral hepatitis or an inflammation of the liver. That's A, B, and C. I'm not going to get into the different types of hepatitis, but it's general viral hepatitis is a big cause of intrahepatic jaundice. Then you could also have something called liver cirrhosis. Now, liver cirrhosis is one of the many results of excess alcohol consumption. So if we go over here, zoom in here, I'm going to talk about this up here, but let's look at this. This is a healthy liver. It's got some nice color, nice healthy two lobes. Here, it's this zombified looking liver. This is what happens when too much alcohol is consumed. It does incredible damage to the liver, and this can result in jaundice. Then we have alcoholic liver or fatty liver. So if we go over here, We have a healthy liver, and then we have a fatty liver. You can clearly see the difference. This is another stage in alcoholic liver disease. These two right here can happen if you consume too much alcohol. I believe fatty liver is much, much more common. Then you have drug-induced jaundice. Now, this can be a result of all kinds of different things. I made a video a while ago talking about NSAIDs. If you consume too much ibuprofen or Tylenol, you can damage your liver, and that can cause jaundice. Now, the amount you consume has to be pretty high, but the rule of thumb is you do not want to consume more than necessary. There's a reason why there's a label on all those bottles saying not to consume too much in a 24-hour time period. Then we have post-hepatic jaundice. So after the liver processes things, this is oftentimes obstructive jaundice. So if we come in here, I mentioned that the bilirubin is stored in the gallbladder in bile. Well, when this is processed, it moves through this tube to get processed in the body and excreted as waste. Obstructive jaundice occurs when you have blockages in this delivery system, which causes a buildup of bilirubin getting into circulation, thus causing the yellowing of the eyes, the skin, and all the other issues. These are the three types of jaundice. As I mentioned before, in each type, there are many different causes. I just wanted to list some of the most common ones because I couldn't get to all of them. So let's go to the last slide and talk about the signs and the symptoms. So the signs and symptoms of jaundice are headache and fatigue. And we've talked about the noteworthy symptoms of a pale yellow skin, pale yellow eyes. There's also an enlarged or tender liver, itchiness, stomach pain, vomiting, low appetite, weight loss. These are most of the signs and symptoms, but specifically the yellowing of the skin and eyes are a clear indication of jaundice. I don't think there's any other condition that causes that type of color in your skin and your eyes. And as I mentioned before, it's a sign of a greater issue. So treatment for adults, from what I saw on the Cleveland Clinic website, it is not really required. There's really not much treatment. I'd assume as you treat the issue, the jaundice goes away. I do not know the specifics, but I read that there is not much treatment for adults. Now for babies, on the other hand, this is where it gets interesting. There are a few different types of treatment, but I wanted to mention this one called phototherapy. So here we got this baby in this little crib with this light being projected onto it. Got a little mask on, and this is a special type of blue-green light. And you might be asking, how is this helping this baby and their jaundice? Well, it just so happens that this special type of light changes the structure of bilirubin, allowing it to be processed the way it needs to be processed. I do not know how that works. It sounds very interesting, but I just wanted to mention this because this was a really, really different treatment that I've seen, and it seems to be pretty successful. So let's get into the summary and review what we learned. We talked about how jaundice was a result of an underlying issue causing the yellowing of the skin and eyes by a buildup of bilirubin, this byproduct of red blood cell breakdown. Then we spoke about the three different types of jaundice: prehepatic jaundice, oftentimes being an excess red blood cell breakdown causing a buildup of bilirubin; intrahepatic jaundice, oftentimes a result of viral hepatitis; posthepatic jaundice, oftentimes a result of obstructive jaundice. Then we got into the signs and symptoms: headache, fatigue, the yellowing of skin and eyes, vomiting, enlarged tender liver. We talked about how there's not much treatment for adults, and in babies, a treatment called phototherapy with the blue-green light can change the structure of bilirubin, allowing for it to be processed properly to relieve jaundice symptoms in infants. So that's all I got. I hope you guys learned something new. Personally, I knew about jaundice and I knew about the bilirubin thing, but it was really helpful for me to learn the three different types of jaundice and to get some more useful information regarding what this thing is. So thank you guys so much for watching and listening. Please like, comment, and subscribe. Tell your friends, and I'll be back soon with another video.